Well, welcome to this month's Focus On, and what I really want to get an update on this month is the services around digital health. We've spoken before about all the new developments that are taking place, but I know, Pete, you've expanded the services in digital health, and I just wondered if you could update us a little bit about how you've expanded those services and the benefits for our communities.
Yeah, certainly. So we provided the Skype consultations for the care homes, where they're Skyping patients in that are acutely unwell. We're doing a clinical assessment and looking for the best team to respond to prevent them unnecessarily attending our A&E department. We've also started to work closely with our North West Ambulance colleagues. We have a response vehicle and we're able to pull calls off our 111 and 999 call stack for the Tameside and Gloucester area and provide a response element if it's appropriate, again to prevent unnecessary attendances at our front door. And we've had some great success with that. We've recently also just bolted on the APAS service, which is the acute patient assessment, and it's where the North West Ambulance Service are pushing work to us that they feel that we would be appropriate to respond to as well. So that's only been up and running a couple of months, but we've had some great success with it. We're also supporting our GP colleagues with referrals into the organisation for our ambulatory care and our GP bay to prevent these sort of frail elderly patients coming sitting in our A&E department. They go direct into a medical bed, which is a lot more nicer area for them to aid. And we also support the long-term conditions service, or the extensive care service, with patients that have COPD and heart failure. We have a monitoring system whereby patients have blood pressure, SATs, temperature, weighing scales, all in their own home, and they would record these on specific days, say Monday, Wednesday, Friday, and it Bluetooths the results into a computer system that we have, and it gives us a reading around whether that would be the normal agreed set parameters for that patient, and it flags up if it's outside. We then contact the patient and we would have a conversation with them about what's going on, why are they triggering outside the limits. We'd look at the medications, what inhalers they can use to alleviate any exacerbations or any steroids that they may need to commence on, and then get a GP or the extensive care team to go out and advise whether antibiotics are appropriate or not. Again, preventing people coming in and preventing them from deteriorating to the point where they would need to access the emergency services.
And I think that's fantastic, because I went to work with staff within the community, and the team I went out with was the long-term conditions team, and we visited a number of patients, and they definitely didn't want to come into hospital. But I could actually see the benefits of linking that service with yourselves. And actually, when I came back to the trust, I was informed about what you were doing with the long-term conditions team and so forth. So it is fantastic, because I saw the benefits that you could provide for that cohort of patients. So how's it going, the long-term conditions? Because that's something that's been quite recent in terms of your service portfolio.
Yeah, so again, from the long-term conditions, it's evolved into the extensive care, which is a bit more of a broader spectrum. But what we found is that we've inherited some of the patients, if you like, that have been under the care of the long-term conditions before extensive care. They've been on the system for quite a while, and these patients are experts really in their own care, and we found that the biggest benefit to that service has been that telephone call and having that human conversation about how are you today, how are you feeling, and what's making you feel better, what's making you feel worse. So we've decided to do a full review of the telehealth system, looking at using it a bit more of a slide on, slide off system, instead of having people sat on it, recording their observations when they've been normal for long periods of time, or again looking at if they're getting the bigger benefit from a telephone call. We'll have a system whereby we would go out and ask patients 5 very individualised questions for themselves to be able to identify their triggers for when they're becoming unwell at an early stage. Again, looking at that personal touch of being able to tailor the care for that patient as well. We think by monitoring these patients and getting some of the sicker ones onto a full monitoring system. The Weller ones are the ones that just get the telephone call. We would free up resource and capacity within our extensive care or long-term conditions teams to be able to start to respond perhaps to some more of the acute focus within the community.
Yeah. And so, you know, if you're worried about a patient within the long-term conditions monitoring system, you've just been talking about linking back with the long-term conditions team, and we've got some GP extensive care team, haven't we? That we've got 2 at the moment, 2 GPs. Are you able to talk to them about any concerns you have?
We can ring them. We can. You know, they're very amenable at listening to us and advising what we should be advising the patients to be doing, and arranging for the team to go out and then visit as well if we need be. And we've been meeting up quite regular actually as a team to see how we can sort of enhance one another's services, and we've found out that, you know, they can provide quite an urgent response if needed as well. We can get them out within the hour, and so that's been really good.
Excellent, because I think there's lots more we can do with the digital health team, and I can just see the benefits over the last few years as you've been developing your services, and the number of admissions we've avoided to hospital and the number of bed days we've saved is quite significant. And I know that everybody's coming to see what we're doing here, and I think we can support some of the developments that are happening across Greater Manchester as well, and certainly there's lots of learning for others. So it's fantastic, and I just wanted to thank you and your team very much, because as you can see the benefits both in terms of some of our performance matrix, but also from a patient perspective. It's better quality of service we're offering. So thank you very much indeed.
Thank you.